Hi, my name is Dr. Bayat, and I'm a graduate of USC School of Dentistry, class of 2004. Today, I want to give you some information on bleeding gums. Bleeding gum is caused by bacteria, and the name for it is gingivitis, which is the Latin word for gum disease. If you notice bleeding when you're brushing or flossing or eating food, those could be the signs that you're suffering from gum disease. Luckily, if treated early, gum disease is treatable and reversible. So it's very important, if you notice these signs, that you visit your dentist and have an examination. Most likely the dentist will take some x-rays from your teeth, and by looking at those x-rays, the dentist would be able to determine the severity of your gum disease. At that time, the dentist will diagnose your gum disease and recommend you different treatment options depending on your gum disease. These could include deep cleanings, which is also called scaling and root planing, irrigation, which is when the dentist puts medication around your gums. Also, the dentist could recommend laser therapy to kill all the bacteria that exist and live in the gums. In some cases, when the gum disease is really advanced, the dentist also has an option of referring you to a periodontist, which is a gum specialist who is able to treat the more advanced types of gum disease. So it's very important to visit your dentist when you notice the bleeding gums, and the importance of that is because gum disease is reversible in the initial stages. So if you catch it early and treat it early, it could be reversed. But in more advanced cases, it cannot be reversed, and that's when the periodontist tries to intervene and just stop the progression of the gum disease. Also, patients that smoke could have more signs of bleeding gums, because smoking contributes to bleeding gums. There are also certain medications that cause bleeding gums and swollen gums. So it's important to visit your dentist and go over the list of medications that you take, so the dentist can evaluate and see what's the real cause of the bleeding gums. In some cases, also vitamin C deficiency could lead to bleeding gums. Lack of flossing could be another cause for bleeding gums. Sometimes genetics, such as bleeding disorders, is the cause of gum disease and bleeding gums. And sometimes wrongly positioned teeth and genetics can be the etiology behind your bleeding gums. So the point I'm trying to make is, again, very important that you visit your dentist to find out the correct reason for your bleeding gums, and that it could be treated early and hopefully be reversible, so it won't cause any damage. Hopefully this information was useful to you, and hope to see you at one of DR.ZAK's dental offices throughout Southern California for your next dental examination.